Anchoring endoscopic mucosal resection versus conventional endoscopic mucosal resection for large nonpedunculated colorectal polyps, a randomized controlled trial. Introduction. Colonoscopy reduces the incidence and mortality of colorectal cancer, CRC, by detecting and removing premalignant polyps. However, post-colonoscopy CRCs account for 9% of all CRCs, and 20% to 30% of post-colonoscopy CRCs are likely related to incomplete resection. Conventional endoscopic mucosal resection, CEMR, is the preferred method for the resection of large nonpedunculated polyps because the submucosal injection is expected to reduce the risk of deep mural injuries from electrocautery and increase the complete resection rate by securing a clear margin of normal tissue. However, the incomplete resection and local recurrence rates of EMR for polyps larger than 10 millimeters in size have been reported to be as high as 20% and 15%, respectively. Anchoring EMR, AEMR, or tip-in EMR is a method for the complete resection of large-sized colorectal polyps. The only difference between AEMR and CEMR is the process of making a small mucosal incision at the oral side of the lesion, which is helpful for deploying the snare in a wider area laterally and avoiding slippage during ensnaring by anchoring the snare tip into the submucosal layer. To date, however, only a small-sized randomized study has been conducted to compare AEMR and CEMR for large nonpedunculated colorectal polyps. Therefore, this study was performed to evaluate the efficacy and safety of AEMR compared with CEMR for the endoscopic removal of nonpedunculated polyps of 10 to 25 millimeters in size. Methods. Polyps with sizes of 10 to 25 millimeters were randomly allocated to either the AEMR or the CEMR groups. Results. 105 and 106 polyps were resected using AEMR and CEMR, respectively. In the intention-to-treat population, the complete resection rate was 89.5% in the AEMR group and 74.5% in the CEMR group. The en-bloc resection rates for the AEMR and CEMR groups were 92.4% versus 76.4%, and R0 resection rates were 77.1% versus 64.2%, respectively. The median total procedure time was 3.2 minutes in the AEMR group and 3.0 minutes in the CEMR group. There was one episode of delayed bleeding and one perforation in the CEMR group. Conclusions. AEMR was superior to CEMR for the complete resection of large colorectal polyps. AEMR can be considered one of the standard methods for the removal of colorectal polyps of 10 millimeters or more in size.